It's a much easier visit, I must say. I mean, I think initially you think going through the options and everything takes a lot of time, but honestly, in the end, it requires fewer visits because I send them to the specialist. They know what questions they need to ask. When they come back to see me, they're much more informed. And so we can have a higher level discussion on what the follow-up is going to be, what the course of treatment will be.
To the extent that a patient can share every concern as much as possible, let us know exactly what's going on, not be embarrassed, not be afraid, not to assume that we should know it already or that it was said before, that it's not important sometimes to say it again, and to understand and to know that we don't have all the answers and it's not simple. And really, it's about coming to a decision together about what the best option is.
Some patients sort of are still of the old school where the doctor knows best and they really don't even want to know what some of the options are. So sometimes I'll try and put forward the fact that there's more than one way to go about this, and I really actually truly need your input because we can truly go two ways on this one, and it's your preference that's going to dictate which way we're going to go.
My name is Nuna Kim. I'm the medical director at Charles B. Wong Community Health Center. I'm also a pediatrician. I do see holding back. We have a phrase, we have that, what doctors call the doorknob question. You've already stood up and you're ready to say goodbye and your hand is on the door, and then the patient finally, has the courage to ask, oh, by the way, doctor, one last question. And you know that that is the main reason they are here. They couldn't ask it for the entire interview, and then finally, I have my, he's about to leave the office. I have to get this question out. And that's when that question comes out. And I've always been in the habit of, before I get up, before I end the visit, I always ask any more questions, anything else you want to ask me. And I do try to make it clear that the patients should ask anything they feel they need to ask. There's no stupid question. There's no, this is your health, and obviously we went to med school, so obviously we know certain things, certain technical things, but obviously the patient isn't expected to know those things. And it's our job to make that understandable to the patient. Why is it hard to make this decision? Sometimes it's not the most obvious thing. It's not just I'm scared of the surgery. It's actually, I don't want to lose my job if I have to miss out because of this surgery, or I have no one to take care of the other kids if I go to the specialist. So sometimes those options are kind of weeded out as we go through that decision-making process with the family.
I'm Dr. McCoy, and I practice at Morris Heights Health Center in the Bronx. If you have had difficulty with something, don't be afraid to say to the physician, I really couldn't do that. Or I have trouble taking this medication. Or I really am worried about taking this medication. Or I think it's going to do something harmful to me. I don't think it's worth taking this medication. So often, patients want to please us also and don't share with us truly what they are doing or what their real concerns are, either because they're embarrassed or they don't want us to think ill of them. We may start off miles apart. However, I think if I give the person in front of me the impression that I'm open and I'm listening and I'm there for them, it's just, my full attention is there. And I'm concerned about them, and I want to get as much information as possible. The opportunity is there to have a better outcome, because when someone is involved and someone feels that you're concerned about them, the outcomes have to be better.
My name is Dr. Andrew Gotlin, and I'm the medical director of the Ryan Chelsea Clinton Community Health Center. The mythical doctor who knows all. When I first graduated from medical school and residency, it felt amazing. I have a distinct memory of sitting on a plane, flying somewhere, thinking to myself, I'm a doctor. And if there's a medical emergency on this plane, I'm the one who's going to pop up. And how many other doctors are there sitting on this airplane? So at first it felt really great. However, I learned early on that the mythical doctor does not actually know all, and he's not, or she is not, all powerful. In terms of giving up control as a practitioner, it's easier as I get older and more experienced in medicine. Coming out of medical school and coming out of residency, you're not taught so much sort of the fine art of patient negotiation and agendas, both my agenda and the patient's agenda. So in the beginning, it was actually very challenging because I knew what the right thing to do was. The textbook said A, B, and C, and the patient's telling me, no, I don't want to do that. At first, it feels very personal that you're saying no, you can't say no. The book says yes. And they may have very legitimate reasons. Patients may say, you know what? I know that statins can cause problems with the liver, and I'm just not willing to take that risk. I know the chance is low. I've done the research. I get it. I know the chance of not treating high cholesterol is serious. I get it completely, but I just really don't want to do that. And there are ways around that as well. Statins are not the only medications that exist for cholesterol. So let's talk about this other class of medicines that is an older class of medicines and works quite well. It comes with its own set of side effects, but maybe these are more palatable side effects to you than perhaps those would be. Or at the end of the day, it's your body. You get to choose completely. So we're going to follow you. We're going to take all kinds of risk reduction strategies. Granted you have high cholesterol, we're not treating it. How are we going to modify your diet even further, exercise further? Should we place you on an aspirin for prevention of heart attack? To work with the patient as much as possible while presenting them really with what I consider to be the facts, and then ultimately respecting their decision and working with their decision. With a little bit of experience and a little bit of time and a little bit of watching patient outcomes, things are not quite as black and white as perhaps we learn them, and there are a lot of different choices that can be made. So it gets easier as time goes by, and I think it's really the practitioner's job to pull his or her ego out of the equation a little bit, and once you can do that, it becomes simpler and more fulfilling to interact with the patient in terms of getting their feedback as well and having that be something valuable and coming to a decision. If you have an interaction, or one has an interaction with a patient, and you don't participate in shared decision making, and it's somewhat rote, where you go into the room, you see the patient, you make your diagnosis, you give them your treatment plan, they say okay, you go to the next room, for me, I can say that it becomes very boring, and medicine becomes very rote and routine, and you miss a huge part of what's so satisfying about medical care, which is, 20%, let's say, of medicine is about knowing the right diagnosis and the treatment plan, and 80% is knowing the person, knowing how to interact with them, knowing what makes them tick, learning about their lives a little bit. It's much more fulfilling to have a dialogue with somebody about a treatment plan and a decision-making tree, a decision-making process, rather than just going in and just doing the bare bones basics. So I would say that if you don't participate in active dialogue with your patient, things could get a little boring and a little bit rote. So for longevity in a profession, it's nice to talk to people in general, and when they are patients, all the more so.